It's nice to see everyone here today, which is a really special day. It actually will only happen once, the day that you go from being a medical student to a doctor. And I'm extremely honored to be here to celebrate it with you. As you heard from Dean Perlmutter, my own graduation was exactly 10 years ago. And I sat where you sat in our fresh robes, overflowing robes, filled with anticipation, waiting for celebration, which you deserve because you've all worked really hard. Actually, being here today is giving me flashbacks, and not just because I'm with all my professors who I remember well from my time at WashU, but I also am having flashbacks to the anxiety of those first exams, even if they are pass-fail, which I think we're all thankful for. And there's also the flashbacks of the long lectures while we're waiting for the few moments to see the actual patient in the practice of medicine course. And then there's the thrill, of course, of starting on the wards in the third year, and then the wonders of, shall we say, a more relaxed fourth year. All right, so I see from the smiles that fourth year continues to be a good year here, and you all deserve to relax and be happy and to celebrate, especially in the presence of your professors and faculty. So many of my most significant mentors are right here at WashU, and I know that I will be forever grateful to them. So I hope you will join me in thanking all of our faculty and staff for their teaching, their guidance, and their mentorship. Thank you. Your school, our school, Washington University School of Medicine, is an incredible institution with incredible history. Since its founding, it has taken great pride in upholding the highest quality medical education and commitment to serving the community through clinical care and research. Now, this dedication continues on today through our dean, Dr. David Perlmutter. So please join me in thanking Dean Perlmutter for his leadership. We celebrate today with one more very important group of people, and I hope that you will allow me to share something personal with you. When I was in my second year of medical school here, my mother was diagnosed with what turned out to be metastatic cancer, breast cancer that by then had spread to her lungs and her brain. She was very ill after multiple rounds of chemotherapy and radiation, but somehow she made it here to St. Louis from Los Angeles for my graduation. It was the last time that my family and I were together. So I think about my mother every day, and especially now as I'm expecting my first child in a few months. And I think about my husband is here too, Sebastian, so you can congratulate him afterwards. But I think about my mother today as I see all of you with your families, because your graduation is their graduation too. Your hard work was made possible through their dedication and sacrifice. So thank you parents, thank you siblings, thank you spouses, thank you children, thank you grandparents, thank you all the family and friends who are here with you today and every day. As we celebrate, I want to challenge us to reflect as well. My greatest joy in being a doctor is taking care of patients, and so I want to tell you about a patient. Let's call her Jessica, who I met when I was an intern in the emergency department. She was my age at the time, in her mid-20s, and she was a competitive swimmer and had some back problems. Her doctor prescribed her opioid pain pills, Percocet, Vicodin, OxyContin, and she became addicted to them. She began going to other doctors to shop for more. And at some point, she switched to the cheaper version that was more readily available, heroin. She lost her job. She dropped out of school. She was kicked out of her home. Now, I got to know Jessica because she came to the ED nearly every week requesting help for her addiction. She knew that she needed help. I knew that she needed help. Every nurse, every social worker, all of us who saw her knew that she needed help. But every time she came in, we would tell her that we couldn't find her an appointment that day or even the next. Maybe she would have to wait a few weeks or even months. So she'd go back home, she'd go back on the streets, and she'd relapse. Well, one day I saw her one last time. The paramedics found her unresponsive. They brought her to the ED, and she wasn't breathing. We worked for nearly an hour to try to resuscitate her, but despite our best efforts, Jessica died. Now, this is a patient who came to me, came to us in our hospital requesting help not once, not twice, but over and over again, dozens of times in total. And because we didn't have the help that she needed, she died. She died because I failed her, and we collectively, as our healthcare system, failed her. It is a profound and humbling realization that the limits of modern medicine are not just defined by the medical treatments that we spend so much time learning or the scientific discoveries that are still ahead of us. It's actually quite unbelievable. I mean, after all, didn't we go through all this medical training because we're the ones to save and to prolong life? But studies also show that less than 10% of what determines how long we live depends on the treatment that they happen to get. Because what determines length of life and quality of health isn't just about the health care that's delivered within the four walls of the hospital, but also about the other factors that contribute to health. Now, we see this right here in our backyard. Just west of us in Chesterfield, a child born today can expect to live to 82 years. It's pretty good. But not so many miles away, just north of downtown St. Louis, a child born today can expect to live to just 67 years. Less, by the way, than a child born in East Timor and Iraq. The reasons are complex, but they start from childhood. 2 out of every 5 children right here in St. Louis live below the poverty line. On any given day, there are hundreds, if not thousands, of children, of kids who are homeless. There's violence around us that we read about in the news, but there's also trauma, this deep trauma that comes from not knowing as a child whether you're going to come home to a roof over your head that night or dinner to eat. There's trauma from growing up in families afflicted by addiction and from inheriting legacies of discriminatory policies and structural inequities. It's often said that the currency of inequality is years of life. If that's true, then the opposite of poverty is health. Now, these other things that determine health, these social determinants of health, please remember them. Please remember that your patients don't exist only in your ER, in your inpatient ward, or in your clinic. They have their lives to live in their homes with their families. And your medical care has to extend beyond the 4 walls of the hospital. Make no mistake, of course, that this is hard. And in medical practice, and I'm sure that all of our attendings will attest to this too, that we are constrained by things like time, we are constrained by things like the system, and it may not always pay to think about the social context of our patients' lives. It may not reimburse. There's no diagnostic code for that. And some might even say, what's the point of asking if there is nothing that I can do to change these other factors in our patients' lives? But I challenge you to think about every interaction as the opportunity for intervention. If we don't ask the 19-year-old man who comes in with a stab wound about what happened, how he lives, is he going to retaliate if we just treat and street him? Will we regret it when he comes back as the victim or perpetrator of another violent crime? If we don't ask the 74-year-old woman who comes in with congestive heart failure about the food she has access to, about the transportation needs she has, the financial difficulties of obtaining medications, are we really doing our job to improve her life? And then if we don't ask the 25-year-old woman who comes in because of drug addiction about where she lives, what support does she have, and do our best to get her into treatment, while we look back and think about the life that we could have saved. In your residency, you will continue to learn about the latest scientific advances and cutting-edge medical treatments. Please do that, and please be the best doctor that you can be, because our patients deserve no less. But please also don't forget the world around our patient that we must also engage in. Ask the questions of your patients, and not just about their bodily functions, but also about their families, their homes, and their lives, as a doctor, as a leader, and as a member of the community. This is how we're going to strive for a future where our children live no longer determines whether they live. Not far from here, where we sit today, is Ferguson, Missouri, where 3 years ago, there were riots and unrest following the death of an unarmed African-American man named Michael Brown. And in Baltimore, where I live, in April 2015, another unarmed African-American man named Freddie Gray died while he was in police custody. The world saw Ferguson burn, and the world saw Baltimore burn too. They saw our cars on fire, they saw our stores looted, they saw our youth arrested. But as Baltimore's health commissioner, I saw something else unfold from behind the scenes. I saw Mrs. Mabel, who was a 62-year-old woman who had a heart attack a year ago and who had run out of her blood pressure pills. Her pharmacy was one of the dozen that was burned down or looted or closed, and she and 200 other seniors in her building didn't know how to get their prescriptions filled. I saw Mr. Paul, a 55-year-old man. He was a diabetic who was out of insulin, and he thought that the best way to hold out was to stop eating. I heard from many others in our city, our fellow residents who were suffering and dying. There was no instruction manual for what to do, which was scary. But what was infuriating was that there were plenty of people in our city and around the country, around the world, who were questioning whether we had to do anything at all. I mean, aren't there hundreds of pharmacies and stores in Baltimore? True, but could I tell Mrs. Mabel, who is in a wheelchair and uses an oxygen tank, to walk an extra 12 blocks to get her medications? Or could I tell Mr. Paul to board 2 buses to get insulin and groceries? The goal of medicine and public health is to go to where people are and to help them with what they need. This is what we did. When we saw our residents suffering, our health department and partners, including our local medical schools, set up a system to help every person whose health was affected. We arranged transportation to hospitals for patients who needed dialysis and chemotherapy. We figured out who needed what medications, how urgently, and we delivered them to their homes. We organized food distribution and for a way for our seniors to get groceries and other services. Now, of course, our efforts didn't end. They've continued with trying to increase food access in areas of food deserts, setting up phone hotlines and access for treatment for individuals needing mental health and addiction help, and of course also home visiting programs for our children to reduce asthma and lead poisoning. But no matter how much we do, there's still more. Just the other day, I was in clinic and I saw a patient, a woman in her 40s. She told me that just 2 years ago, she was homeless and going in and out of EDs every week. What changed for her was that she got health insurance. She was able to get her diabetes treated, her blood pressure under control. She was diagnosed with depression and alcoholism, and she got under treatment. As a result, she has a job, she has a home, she's taking care of her kids, and she has her life back. Health insurance, she told me, is her rock. At the time that I saw her, she was crying because she's now worried by everything that she's seeing in the news. And she's worried that her insurance could go, that she'll get sick, and she'll lose everything that she's worked so hard for. These times around us are uncertain times. And I know that I feel the uncertainty and challenge to my core values as an immigrant, as a woman, and as a doctor. But in times of anxiety and angst, all of us have an even greater duty to step up and be that rock for our patients. We have an even greater duty to address the disparities that bend the arc of humankind away from justice. As physicians, we are entrusted with a special privilege, a special job, to identify the injustices, to call them out, and to close the gap of disparities. All of this is hard, but I would wager that none of us went into our professions, none of us entered the school of medicine thinking that it's going to be easy. And as physicians, we would never say, this patient is too sick, too complex, we must give up. So we must apply that same energy to the larger social problems that we see. We need to fight the big fights and correct the big wrongs, because along with the privilege of being part of this rewarding and prestigious profession comes with the responsibility to tackle the most difficult challenges. The patients that other people don't want to see, who society casts aside, that's our job to serve them. Communities that other people don't want to live in or even drive through, that's our job to advocate for them. The people who are the most vulnerable, who are incarcerated, who are homeless, who have mental illness, who live in poverty, who are stigmatized in some way, that's our job to care for them. And we must not wait. Many of you have done amazing community work during medical school. Keep it up. Residency will be busy, and there will be competing priorities, but this isn't about time. This is about the attitude you choose to adopt, about the approach you choose to make, and about the lifeblood of what it means to be a doctor. So please don't wait until you finish your residency and fellowship to start. Please don't wait until you have your private practice and faculty appointment to start making a difference. If you have a patient in front of you in distress, you would never say, I'm going to wait. You would never hesitate to take action. So our communities need us now. Our society needs us now. Do not wait to care, to advocate, and to serve. Let me end by taking us back to where we started, which is celebration. I celebrate with you today your achievements and your bright futures. I feel grateful to be here with so many people who are taking on this awesome responsibility of healing. I'm inspired to be part of this family at the Washington University School of Medicine who will serve our patients, be champions for our communities, and tackle our society's injustices, who will listen, who will question, who will fight, who will serve with urgency, compassion, and action, and who will, above all, preserve dignity and respect humanity for all people. Thank you all for the privilege to join you today on this amazing, joyous occasion. Congratulations to Dean Perlmutter, faculty, staff for carrying on the tradition of this tremendous institution. Congratulations to our parents, our family, and friends for supporting these amazing minds. I applaud you, I celebrate you, I cheer you on this amazing journey towards healing and service. And finally, congratulations to class of 2017, or should I say, congratulations, doctors. Thank you very much.